Behind every successful healthcare journey is a strong ecosystem of partners who share our vision for better patient care, safer practices, and continuous learning. The next session recognizes one such valued supporter who has consistently contributed towards advancing healthcare excellence through innovation and evidence-based solution. May I invite Ms. Ujjwala Pal, Head Clinical Specialist 3M India, to address the gathering. We welcome you, ma'am.
Very good afternoon, everyone. Now I understand that post-lunch sessions can be really dry, but let's try, and I would really want each one of you to settle down so that, and oh, my timer has already started. So very good afternoon, everyone. On behalf of 3M and as well from my end, I would really want to sincerely thank ANEI for, first of all, congratulate them for this wonderful conference and also towards their journey. On behalf of 3M, we are really proud to associate with you right from the foundation, and we are happy to provide all the support that we can throughout this wonderful journey of yours. At 3M, we really take a pride in our association with the nursing fraternity. And from the bottom of my heart, I would want to thank all the teachers, mentors, friends, and the eminent nursing directors present. Thank you so much for the support that we extend to 3M. We really had our journeys intertwined together, and we have ensured that we are not just an industry partner to all of you, but also partnered for a lot of education, a lot of quality improvement programs, a lot of competency building, and a lot of fun that we do together. So thank you so much for that. Now, my first slide, how do I? So what is it that we have to offer you this time? I only want to ask to each one of you that while 3M, you have been partnered with us for our various ICU-related programs, IV-related QIPs, our programs around skin injuries, OT still becomes that one area which is difficult to create any kind of new changes. Most of the gaps that we generally see, as you can see the first gap, the critical gap of SOP adoption. Whenever you stand in your operating room area, you would agree with me that OT is practically a portal, very difficult to access to. You would always have the gods themselves and the angels guarding the OT lines with the scalpel in their hand, and with SOP in your hand, you will still be standing there on the door. How many of you would agree with that? Yes? Okay. So we say that, okay, if a hospital is a kingdom, operating room is sometimes a treasury, sometimes a war room, and a lot of times it's a best kept secret. Okay? You would want to guard that secret for a longer time. However, as a nursing leader, as a nursing directors, and a nursing professionals, we feel that this is one area, if we are able to conquer, that's the only one area that a lot of collaboration which is still required, a lot of adoptions of SOPs which is still required. So first critical gap definitely is around the SOP adoption. The second one, I don't want to touch base on it, you know, the high stress load versus the workforce available. The third gap, which is very important, which is the interdepartmental coordination. One of the simplest example that I can give is, each time when you hold a loaner instrument in your hand inside the OT, you know, there are so many areas which are supposed to be informed, from purchase to CSSD to OT managers, and a lot of times there's a huge lot of miscoordination which happens. As simple as that loaner instruments, WHO is trying to create a SOP of receival of loaner instruments 48 hours prior to surgery. Do you know that in India, we are not able to follow even an 8 hours prior loaner instrument receival because of a lack of interdepartmental coordination. The last or fourth critical gap, which is there, of course, is about the change management with a new guidelines update. In case of OR, the guideline which has been used most of the times is AORN, Association of Perioperative Registered Nurses by US. That guideline updates their standards on an annual basis. Now, how easy and how difficult it is to manage these updates and provide training to your staff. So these are certain areas and the gaps that we see in OT. So while 3M, we have always tried to provide you the best of our solutions, I only want you to remember two statistics. Number one, Institute of Medical Council of Research in 2025 has published one data which has truly taken this leap away from microbiologists. The data of 2025 January suggests that alone in 2024, India had 15 lakh of surgical site infections. That was a multi-centric trial only from 50 hospitals in India. It included the government hospitals, private hospitals, the smaller segments, but a multi-centric study which said that alone in 2024, hospitals, which is only around 50 hospitals in a year, gave 15 lakh of infections and surgical site infections to the patient. Of that, 52% of infection was surgical site infection. So first data, you can go back, check, is the data from ICMR, and that is basically a 2025 study. The second interesting thing, that how do we really ensure that we have less of SSI? I'm sure that you would agree with me that SSI prevention cannot be just a one heroic action. It has to be a bundle care, it has to be a lot of departments coming together, because you would agree that SSI doesn't start with the first incision. It starts long before the incision and long after you do that last stitch to the patient. So the entire perioperative processes is what requires a standardization. And the only people who can truly drive it, that throughout the perioperative standardization, is a nursing team, and we truly, truly believe it. So from 3M, we are coming up with 4 different programs for OR. With a timing of around only 2 minutes left for me, I am quickly going to brush through those 4 programs to all of you. So number 1 is Cliff Safe. Please do remember one more term by Institute of Healthcare Improvement. Those who want to make a change in SSI, remember the CATS protocol by IHI. It's the Institute of Healthcare Improvement by USA, and in 2009, they came up with the CATS protocol that if you take care of your clippers practices, your antibiotic prophylaxis, your temperature management practices, and the sugar control in your patients who are undergoing surgeries, you will be able to control your 70% of SSIs. That's a huge number. And having said that, in India, we are still finding it difficult to follow these 4 simple things. So we have come up with a program that will take care of maximum of this aspect. So number 1 program is Clip Safe program. The program which is designed for your pre-operative nurses, your barbers and technicians. We will ensure that we provide an audit tool. We provide a certification which is from a Healthcare of Skill Sector Council. So you get a government recognized certification to your barbers, technicians who are conducting a clipping, as well as to the nursing staffs. And it helps you create a good SOP for your surgical clipping practices. So that's one program called as Clip Safe program. The second program that you see is Safe Temperature Management program. Now let me tell you, if your patient is hypothermic, which happens to all the patients who are undergoing anesthesia, within 1 hour of your anesthesia, the temperature drops up to 1.6 degrees Celsius only because of the anesthesia drugs. If a patient is hypothermic, he is at a 3 times more risk of having infections. So please ensure that your patient and your hospitals are well aware and managing the pre, intra, and post-operative temperatures for your patients. What is it that 3M will provide you? We have a well-recognized program by AORN, as well as it's a program which is developed by Indian Society of Anesthesiology. We help your anesthesia technicians, we help your nursing staffs know about the temperature management and ensure that you get a certified program along with the SOP designed for the temperature management. The third program that we have is Clean Start. Again, how many of you would say confidently that my nurses know everything about sterilization? Because as a nurse, I can tell you, it was not the topic of interest when I was learning, when I was in LT or in any of my curriculum. So here, we ensure that your staffs are well aware about the cleaning practices and they also know about the sterility check. Again, we developed an audit toolkit, we developed a workshops, and as well as a certification program around Clean Start. So I have spoken about 3 programs. Number 1 is Cliff Safe, which helps you standardize your clipping practices. Second is the temperature management, which helps in maintaining your patient's pre, intra, and post-operative temperature. And third program is the clean program. These are all short duration programs. And if you want a full quality improvement project around this, all 3 aspects, plus few more, we have a side program. You have heard Dr. Sneha Vaidya talking about Beyond the Incision program. So this is our full program, which many of the Apollo hospitals in country, we have done it for 50 plus hospitals in country already. We've got an excellent, humongous response for this particular program, which truly changes the way your OT SOPs are. And it looks into all kind of your pre, intra, and post-operative preparations. So any one of you who think that these programs can be beneficial to your hospitals, please ensure that you connect to the 3M team. I would only want to close my session by quoting the founder of modern nursing, Florence Nightingale, that a very little can be done under the spirit of fear. And at 3M, our motto is to at least take out the fear from SSI. And that can only happen by knowledge, standardization, and competency building. And we would love to be partnered with all of you to ensure that we conquer that fear of surgical site infection. So please connect to your 3M team for any of these programs that you want to implement in your hospitals. Thank you so much.